Hi, I'm Margie Swensson. I'm a registered nurse and the director of Grand County Hospice. I'd like to take a few minutes to share some information about hospice and perhaps clear up some misconceptions. First of all, there seems to be this idea in our society when a person chooses hospice, they're giving up. I hear this in comments like, he's given up fighting cancer and he's on hospice now. I don't think choosing hospice is giving up. I see it instead as a shift in priorities. Rather than focusing on so-called curative treatment, which often involves discomfort, lots of medical appointments, and sometimes emergency room visits, hospice patients instead focus on quality of life and what's important to them. So, what do I mean by quality of life? Well, here's the thing. I know what quality of life means to me, but I don't know what it means for someone else. Therefore, we talk to each of our hospice patients to find out what quality of life means to them. That is, what's important to them at this point in their lives. Our hospice team then works on an individualized care plan which focuses on those things that are important to that specific person. Another misconception is that hospice is only for people who are ready to die or who want to die. That's just not true. Hospice care can benefit anyone with a serious life-limiting illness, and hospice does not hasten death. In fact, a recent study found that hospice patients with certain diagnoses live an average of 29 days longer than those who did not receive hospice care. It's also important to understand that hospice care is not just for the last few days of life. Unfortunately, I often see patients who are on hospice for only a few days or a week before they pass away. These short-term patients and their family therefore miss out on the full benefits of hospice. You see, hospice doesn't just treat physical concerns. We also address the emotional, psychological, and spiritual needs of our patients and their families. You see, hospice isn't just about physical care. We also address emotional, psychological, and spiritual concerns of our patients and their families. Our staff includes doctors, nurses, social workers, and chaplains, as well as a wonderful group of volunteers. So while we still work to make our short-term patients comfortable and peaceful, they may not have the time to forge the deeper bonds with our entire hospice team. This is why I always encourage patients to enroll in hospice sooner rather than later. Finally, I'd like to clear up a misconception about the cost of hospice. Hospice services are fully covered by Medicare, Medicaid, and most private insurances. Coverage includes all nurse and staff visits, medical equipment, and most medications, including oxygen. We interface with doctors, deliver medications to the home, and have a nurse that is on call 24 hours a day, which can be very comforting for both patients and families. Obviously, I enjoy talking about hospice. If you or someone you know has questions about hospice or would like more information, please get in touch with me. I'd love to talk. Thank you.